Hi, my name is Ryan Verla. This is video 2 of my gold standards for COPD exacerbations, and we'll be talking about the preventions and maintenance of COPD and everything included in that topic. So what are the overall key points in the prevention and maintenance of COPD? So one of the main points is smoking cessation. So there's been studies that a pharmacotherapy is one of the best ways to handle smoking cessation, such as nicotine replacement therapy, which has been reliable for long-term quitting. The effectiveness and safety of e-cigarettes as a smoking cessation aid is uncertain at present. So during this current time, there's not really good factors to really indicate a patient to move from smoking to e-cigarettes or electronic cigarettes. In that case, there's in fact more studies to show that it is not as harmful, but just as harmful to quit smoking at all. So pharmacology therapy can reduce COPD symptoms. They can also reduce the frequency and severity of exacerbations and improve health status and increase exercise tolerance. So there are multiple drugs that they can take to help build their stamina up or try to get a regaining of what their life used to be and how their body used to feel back then before the long-term symptoms of smoking. Each pharmacologic treatment regimen should be individualized and guided by the severity of symptoms. So there's going to be different classes and such. On the next topic would be for that and how we can evaluate what they might need to use as a form of pharmacological therapy. Some drug availability and the cost. A lot of these smoker patients are smokers for reasons. Maybe they have certain debts and other unwanted stresses in their life that keeps them from developing a healthy lifestyle. And maintaining a healthy lifestyle can be very costly. So we want to make sure that we're keeping in mind that the patient can afford their therapies. The patient's response. How is the patient's body responding to the effects of their therapy? Is it good? Is it bad? Is it uphill? Is it downhill? Is there other side effects coming along with it, such as weight gain or high blood pressure, high heart rates, or some psychological issues there? And the availability to use these different drug delivery devices. Again, being cost effective and cost friendly for these patients is a very good way to keep these patients on the fast track to stay off smoking and to follow their treatments to the best of their ability. So we also need to really hammer down how these certain techniques for an inhaler should be used. A lot of patients should have a rescue inhaler, especially COPD patients or asthma patients in general as well, because of that chronic cough, that the inability to move that sputum that's in their lungs. We need to make sure that the inhalers that they might use or the treatments or their medications for maintenance that they might use have a good proper technique, because you want to make sure that they're getting the full dose and the full application of their medicine. So just making sure that they're knowledgeable in that area. Then this is a big important one, influenza vaccinations. So we need to make sure that their patients are getting their vaccinations not only with influenza but also with pneumococcal viruses as well. This decreases the risk of lower respiratory tract infections because, again, they have a buildup of sputum. They're unable to move it, so having this availability for them is very detrimental towards their health, to make sure that they have the good availability towards that, so that they don't have to live their life constantly in the hospital due to these sicknesses that could have been avoided. Pulmonary rehabilitation improves symptoms. So being in rehab, it's not just about it's not just about getting better, but it's also creating connections in which they can stay better. A lot of addicts that are, if you're addicted to smoking, it's an addiction. It's something that can be hard to struggle, hard to really stave off on your own. You need to have a community in which you can build people that are accountable towards you, people that care about your health. Um, this will also improve their symptoms, their quality of life. If they're not overly, to live a life where they're not constantly out of breath just from having a simple walk, which most cases, a lot of COPD patients are, and physical and emotional participation in everyday activities. We want to make sure that these patients are really just getting into it, that they really want to be there, and that they really have their heart set on and doing better. If there's a change of mental status and it's for the better, then you'll start seeing good improvements towards the availability into the acknowledgement that they want to be better. So, especially if they have family, if they have family that they want to see grow up, grandkids, kids, and just anyone in general, even if it's as simple as just having a dog, you know, they tend to really anchor into that, so they want to get better. So for the people that they care about, in patients with severe resting chronic hypoxemia, there are long-term oxygen therapy that improves survival. So if you have very severe desaturation of their oxygen, they are constantly just getting overworked with their lungs. Let's say just simply standing up from the couch, going to the kitchen, grabbing some tea, coming right back. That could be as easily life-threatening as it is for someone else who needs to just simply stand up. Patients desaturate all the time, so just make sure that they have that constant availability of oxygen for them to live a better life and to be safe. In patients with stable COPD or resting or exercise-induced moderate desaturation, a long-term oxygen treatment should not be prescribed routinely. However, individual patient factors must be considered when evaluating the patient's need for supplemental oxygen. So, not everyone's the same, and that's the big thing from this takeaway, is that someone can be very different. Again, they could just be simply as just walking up, going to the kitchen, grabbing something to eat, and coming back down, and they could be desaturated to the low numbers, something that could be very detrimental to their health. Or it could be another patient where they're trying to do an exercise and they're trying to maintain a healthy lifestyle, but they can't because they can't catch their breath when they're doing certain activities. We want to make sure that we're monitoring our patients in that manner to make sure that they're getting the best quality service that they can be provided with and care. So when evaluating their need for oxygen, we did make sure that we're doing these testings, making sure that we're very honed and very attentive to detail. In patients with severe chronic hypercapnia and a history of hospitalization for acute respiratory failure. So if they have long-term and non-invasive ventilation, may decrease mortality and prevent re-hospitalization. So make sure these patients get into a specialist where they can see the need. A lot of patients, COPD patients, don't see the need for BiPAP or CPAP machines. They think, oh, it's uncomfortable, it's not really helping, it's just it hurts, or something I don't want to put on, it's too expensive, or it's a hassle. But in actuality, this is what helps patients live a longer life, because they do need assistance. Sometimes the patient just needs 2 liters on a nasal cannula and they're fine, but most patients in COPD, they are pretty severe, and they might need that constant BiPAP or in the night CPAP machines, or whenever they get really desaturated, to have it readily available for them to use. Especially the ones that have history of being hospitalized due to severe hypercapnia or respiratory failure. We want to make sure that they're in a position where they can take care of themselves while having to rely on other people to be constantly checking up on them, though they should have that support. In select patients with advanced emphysema refractory to optimize medical care, surgical or bronchoscopic interventional treatments may be beneficial. So again, people with very severe emphysema, they have that flabby lungs, they can't get any of the sputum out, they're developing viral infections here and there, they're being hospitalized. Well, they're going to need that care for a bronchoscope. They're going to need to have that bronchoscopy where they will get flushed out, and even though it's a very invasive procedure, it's required, it's needed for the patients to live a longer lifestyle, a longer healthy, prolonged life. Because if they're not able to get it out, they need someone to get it out of them. If they can't get their sputum out, they need someone to suck it out. They need someone to really clean out and wash their lungs, and that's what a bronchoscopy is going to do for them. And palliative approaches are effective in controlling symptoms in advanced COPD. So again, if you have a patient or a family member or someone close to you that's very advanced in their COPD diagnosis, that palliative approach could be a very great way for them to control their symptoms. They might need an active healthcare provider there with them, whether that's a nurse or a CMA or CNA. They have someone there, a respiratory therapist. They have that acute, that very rapid response to care that they might need right away. So that's something to also consider for patients that still want to live a longer, healthy life, but they might need that 24/7 hour care. Well, this is the end of my second video. Thank you so much for coming today, and I'll be back for my third video of this video project. Thank you.